I was diagnosed 3 years ago almost, after being sick for probably 7 or more years. When they found it, it had already metastasized and was incurable.
I was diagnosed with stage 2B, stage 4A Hodgkin's lymphoma. It was hard to transition from plainclothes citizen to cancer patient.
I knew before going into surgery, to be honest with you. I had a feeling that I had cancer. Life goes on for everyone else, but for me it stopped at that very moment.
I was on 24 pharmaceuticals a day to combat chemotherapy reactions. After almost dying in the hospital of chemotherapy toxicity, I knew that I had to have a different approach.
I really didn't want to be on opioids. My first surgery, I was on a lot of opioids. It caused me a lot of intestinal pain, and it was just, I don't like that feeling of being on opioids.
I was really worried about addiction. I can't remember the dosage, but it was like 3 times a day, and I needed it. I was in excruciating pain.
My doctor recommended that I try cannabis to help kind of take myself off of the opiates. After having major abdominal surgery within 4 days, I was able to wean myself off of opiates, and I was just using cannabis.
We found in our cancer study, wasn't a clinical trial, that we were able to reduce opioids by 36% for our cancer patients, and 52% of these patients were in stage 4.
Without using the marijuana every day, I wouldn't make it, honestly, because I would have to take so many other medications that would allow me to not get out of bed.
I have an appetite, which I don't have if I'm not using any cannabis. I have less joint pain. I'm able to sleep better. I notice a difference when I'm not able to take it.
Policy and science are catching up, and what that has done is left people in that awkward phase where science and policy are catching up to where they ought to be.
I really felt ostracized. First of all, finding an oncologist that was willing to work with someone that is using naturopathic medicine was extremely difficult.
It's been a process. It's not easy. The doctors write you a prescription for a specific amount. The amount doesn't necessarily correlate with what increments are available in prescriptions. So I go periods where I am not able to get medication.
Opioids are scary, and cannabis is not. I'm very troubled by the stigma associated with cannabis.
We are doing this for medicine. And so through that process, we are able to hone in on what we believe is truly working, and from that we're doing these studies, and these studies are kind of providing patients a roadmap.
One hopes that eventually the science will catch up, and your oncologist, your neurologist will be able to tell you, based on a very large, undeniable body of scientific evidence, what works and what doesn't.
It's a personal choice. Treatment is a very personal choice.
I beat all the odds. I get to put my feet on the ground, and the birds sound different to me than someone else that hasn't had someone sit across from them and say, you have 1.5 years to live.
It's up to us to help the rest of us. So we need to participate in clinical trials. We need to participate in research. We need to participate in advocacy so that we have safe and effective means of accessing cannabis and using it and understanding exactly how to use it so that we can more scientifically and effectively mitigate side effects.